So hello everyone, it's Mary Lou with Resource for Care. Resource for Care is a resource for seniors, those 50 and above, to get information about healthcare and wellness. In the 10-year journey I had in walking alongside families in owning a home care business, I found that most people did not know how to care for a loved one and then went to Dr. Internet to get the answers. And so not knowing whether those were trusted resources, accurate information, or maybe somebody in another country giving you advice, not someone local. So what I've done is made a platform where local professionals can speak directly to our seniors and their adult children, and you know it's someone local, someone trusted, and has a lot of information. I'm a newbie with 10 years. Annette Marlar, thank you for joining us today. Thank you. Annette is a registered nurse, a BSN, and more things than we have time to even express. But I know that you call yourself a dementia comfort specialist.
Yes.
Is that right?
Yes.
Okay. And you're with Kirby Pines and the Farms of Bailey Station.
Yes.
Or Farms at Bailey Station.
Yes.
So we talked at one of our gatherings, which some of us professionals get together, and you had mentioned a topic that is really near and dear to my heart. It's something that people, I don't think it comes to their mind often, but we see it happen all the time. And so we may not solve the issue today, but I'd like to talk about the issue and get your insights and your take on the impact. And I'll let you tell us what that subject is.
Well, what I really want people to know is I don't know a lot about this. Okay? So that's the
You're
first
modest.
thing.
You know more than a lot of us.
And so when I told you that I was interested in learned dependency, I was really at a stage where it became a burden for me on why I had not recognized it earlier. There were so many signs through the 40 years I've been in long-term care.
Yes.
It was there, but I really didn't see the impact of it until I started developing an assessment tool.
Okay.
Since we were opening at the Farms of Bailey Station, assisted living, I wanted to develop an assessment tool that had to do with everyday living.
Okay. Well, before you go on, I want to acknowledge you because you told me, or told all of us, that you were a lifelong learner.
Yes.
And that you grab things from all different places. And I think this is a perfect example of you doing that. You see a need, and then you go out and research it to try to help people with it.
And better understand why I did this, didn't do this, why we developed this or didn't develop that. And then since I deal primarily with dementia, residents with dementia, and very interested in their behavior and body language, then this just really played into what I enjoy the most, and it is my passion. So in developing the tool, I did, of course, look at activities of daily living. That was easy to do.
But share what activities of daily, because a lot of our seniors or people don't know what those are.
Well, they're called ADLs, and it would be grooming, dressing, bathing, eating, ambulating, toileting. These are all activities that we do every day.
Yeah.
And then there are the IADLs, and I won't be confusing about this, but that is where medications come in, using the phone, making appointments, such as transportation,
maybe even
driving to the doctor. Those are ADLs. And so I think the tool really captured that. I will tell you that I like for things to be correct. So I'm on my 119th version.
Oh my goodness.
Because every time I would do an assessment, I'd go, why didn't I think about that?
So over what time frame?
A year.
Okay.
A year.
Wow, that's amazing.
Not, that to me, that wasn't a lot of time because came from an academic setting. Right.
Well, I'm glad we're all benefiting from your tenacity on that.
So then the tool, and as I was going through the tool, assessing residents to come into Shepherd's Path here at the farms, I really began to feel the resistance or the resentment that they have when people do a task for them that they could do for themselves.
So you're talking about the senior themselves,
yes.
or the person, if they're not a senior, with dementia. Okay.
Well, even without dementia, and doing an assessment for assisted living,
right.
I would ask about, well, tell me about your bath.
Yes.
Tell me about how you do that. And the biggest one I think I presented to you the day that we talked about it was I had the little tiny medicine.
Yes.
Box.
Like the pill organizer?
The pill organizer, which I'm anti-pill organizer. But I am. Because at that point, now I don't have a solution. So just okay. I don't have a solution. But it's people who love their parents.
Yes.
Or their grandparents.
Right.
But they put their pills in that box for them. And they never have to remember that. So when I would ask about medications or diagnosis, it was, well, I don't know. Well, tell me what hurts. Tell me what hurts. Or tell me what you have a problem with.
Right.
Or the medications is, I don't know, but my daughter puts them in this box every week. So they no longer are in control.
Right.
And I understand why that's done. Because
sure.
that's one of the first reasons to need to go to assisted living will be medications.
Yeah.
Missing medications.
Right.
But you could dialogue with your parent about that.
Yes.
Remember, this is for this.
Sure.
This is for this.
Right.
So the conversation about their medicines, it's gone in many situations.
So it's not even part of their dialogue or conversation.
But they would accept that assistance. When it comes to, we would talk about, well, tell me about getting dressed.
Right.
Well, I do it myself. And there would be a spouse behind them or a child going,
No, they don't.
No, they don't. And I think it's the feeling, it's so important that we can maintain our independence.
Sure.
And so it really became, I thought, okay, what's really going on here?
Right.
And
so is that like the indicator that there was something amiss,
Well, because their answers would not be the same as maybe what the caregiver. But then when I got into the actual caregiving, I found that the caregiver automatically was doing the task, not assisting them with it. And there are reasons why that happens, but it's easier.
Yes.
And so, but I was still back on, they feel bad about someone doing it for them, or they don't like how they did it.
Right.
But you didn't ask me how I wanted it done.
Yes. Yeah.
So then, as I developed the tool, there are many different versions of it. I got a little bit more detailed about what the caregiver needs to do.
Can I share something with you with my dad? And my take on what you were saying also, in addition to what you said, was that my dad, he had some brain bleeds, and so he got confused. There were other things, but he got confused. And I felt like he got agitated because when someone stepped in to do something or fix something for him, I sensed that he felt like they were telling him he was wrong, or that he did it wrong or made a mistake. And they were really bringing that was more important. Yes. That was so I think that was part of his agitation, Do you think that's true too? That people feel like they're being corrected?
Especially
Or you can't do it as well, let me do it for you?
With residents who have dementia who may not have taken in everything that was being said.
Yes.
I also found that, just in my experience, that we tend to go right into a task.
Yes.
So I did go back and do some research on what caregivers, usually the certified, and in the material that they study, this is how you do the task, not how you help someone do this
That
task.
seems like a small nuance, but that's a huge difference.
Was the biggest factor.
Yes.
So
you're talking about like CNAs, like certified nursing assistants.
Doing what
they go through courses.
And then also doing it at their pace rather than the person's pace. So what I've learned so far in this is that I think we will be retraining on what our place is in that task. The task is an opportunity to be with that resident.
Yes.
Our job is to assist them as they would like to be assisted.
Yes.
And that's where I think the preparation of talking with them on how they want it done is so much more important than going in there and doing it.
Right.
But if they say, I can't do it, then they are asking, they want your help.
Yeah.
And so I'm very fortunate in Ruth's Way that we have at the farms.
Now, Ruth's Way, just because not everybody's going to know what that is.
Ruth's Way is a memory support, just like Job's Way is at Kirby Pines.
Oh, okay.
And Ruth's Way from the Bible. And so there are 2 staff members there that I'm working closely with who are absolutely got it. They know. They don't do before they ask.
Before they ask. Yeah.
No. Yeah. And they observe.
Right.
And so they are my trainers for other people.
Sure.
And they just have that innate ability to know to back off before you go and do something. I'm fascinated with them.
Yeah. As you're talking, I'm thinking about any task that we do, we tend to jump from the thought to do. Yeah. But there's probably a lot of different steps, like to doing the task. We could break it down further and meet them where they're at. Does that make sense?
It is, and after again being in the academic setting, it's planning. The pre-task, the task, and the post-task.
Okay.
And that's really the way you learn a procedure. So the important part to me is the planning part. So knowing that it's the day that this person usually gets their bath. It's the day they like to have it.
Sure.
It's very important to approach it that way. Today's Tuesday, and that's when you like to have your bath. So I'm ready to help you if you'd like to go. Mm-hmm. So, but you already have the bathroom's warm.
Yes.
The towels are there.
Right.
You've got to change your clothes.
Right.
You're already prepared.
Yeah.
And if they say, no, I don't want to do it right now, then I'll come back a little later.
Right.
Yeah. So what is the urgency that we have to get things done on our schedule? Unless they're unsafe.
Yes.
If it's unsafe.
Yeah.
But if not, does it really matter?
Does it matter whether it's a half a day or 2 hours or different? Yes.
No. I had a resident one time in memory support who liked to pick up their green beans with their hands.
Right.
He would eat them that way.
Yes.
Now, the education was with the family. He was very happy doing that.
Right.
I was happy he could do it because he was doing it on his own. So sometimes we impose these rules that aren't necessary in dealing with residents.
I found that with my father. It was hard to have people see him make a mess.
Yes.
Put the fork up to his mouth, drop half of whatever, but he still was picking up the fork and still able to feed himself, who cares if half of it didn't make it where it was supposed to be? It doesn't, and we don't need to reach in, and we don't need to wipe his face as soon as he does that. You know, let him eat his meal the way he can eat his meal. You know, so.
People that they've got one shoe's on the wrong foot. If they're not uncomfortable,
right? If they're not crying about it,
I mean, I'm not. I say pick your battles.
Yes.
What's important?
Right.
What's not important?
Right.
So then, in using the tool, then I begin, as I said, to better define specific things as far as do they need help getting, if they're going on transportation,
right?
Getting their walker into the back of the car.
Yes.
Maybe it's the jacket that they need help with, but not the blouse.
Right, right. So it's not dressing, it might be certain items.
Yes.
Right, so break it down.
Break it down, and also I think breaking down the task for them that we say, I know you want to brush your hair. Okay, you've got to help them to find out which side they usually brush first, or the back or their front.
Sure.
So that we don't change their pattern.
Right.
Because that's so important. So much is taken away when someone goes to a facility.
Yeah.
So the more they can keep that they're familiar with, then the safer they feel. And that is always my goal, is safety first. And so I think with the activities of daily living that I found, that's where we need to concentrate the most first on that.
Sure.
So that the staff knows that pulling back is better than doing.
Right.
And I think they have to learn that. And also that we will support them in that.
Right. So what ways, I mean, you've been training people for a long time. What are some of the methods that you'll use to impart this information to these certified caregivers to change how they're approaching things?
Really after doing this assessment tool that I found I had to break things down more. So we can say, oh, you need to go help Miss Smith. You're going to go help Miss Smith with her bath. It's more than that.
Right.
It's knowing how she likes to have the bath. And I think that we don't take in consideration that the dependency is driven by us.
Yes.
And first we have to own that. So I'm saying it's gonna be a little hurdle for me. If I could, I saw an illustration one time. If I could take staff and unscrew their head, take out what's in there, I got to get this done, and then put in there When
you find out how to do that, I have several situations
I know.
where that would really help.
I wish I could do that. I mean, that I can't do that.
No.
So, but also recognizing, I think there's more to it. The staff, they have to understand that this person, that they truly want to be independent. And that's how we're made.
Yes.
To survive. And so then how can we help them do that? One thing is we need to know their history. And I'm a big advocate of history. What do we know about this person?
Right.
And if I can just use a personal thing, I'm a cancer survivor, breast cancer.
Congratulations.
So some of the tubs that I have, or spas that I put in the spas in both areas, they go all the way back. When you go in, you sit, and then you're able to crank it so it goes back so that you're covered. Here. Okay.
Yeah.
As a person who may be in a nursing home or assisted living, I didn't want my chest to show.
That makes
in
sense
the water.
to me.
And that was very important to me. That I think about women, and they may be in the same situation for me.
Absolutely.
So personal experience is also a driver in some of the decisions that we make. So if you take that bathing, now let's just really take that apart.
Yeah, break one down for me.
I had a resident who I said, well, tell me, do you, how many showers, do you usually take a week? Oh, 3 or 4. And do you get in the shower? Do you need help? Well, no, I really don't shower. What do you do? She fills up the lavatory. She bathes sitting by the lavatory.
Okay.
Because she's afraid to get in the shower.
In the shower.
Yes.
Yeah. Yeah.
Now, what do you do with that? That's the way she likes to bathe.
Yes.
We talked about bathing certain areas every day.
Right.
She did that.
Okay.
But there's no reason to change.
Yes. Her method of how she does things. But
one of the family members was very interested in her, telling her how she could get in the shower because we've designed it so you go straight in here.
Yeah.
There's no lip on it.
Right.
You just go straight in, even if you're in a wheelchair or standing. There's nothing
you can
to
still
lock
get
on.
in. Yeah.
That was very important to the child, but she already had the way that she felt like she was clean.
Right.
And there were no history of urinary tract infections,
Right.
no odor situation, nothing like that. She had decided how she wanted to bathe. It was not my job to tell her to bathe differently.
Right.
So I think we have to realize that sometimes the best decision is not to do anything. Just follow their lead.
Yeah.
But the other thing about staff is breaking down the history.
Right.
And I use bathing, the history of how they
Right,
bathe or how often they bathe. And really understanding how they do that.
Right.
And so, do they use a bath cloth? Do they use a bar of soap?
Right.
Do they use the dispenser? All those things so that we aren't asking them to change the way they take care of their everyday life. That's why I named the assessment Every Day.
Oh, is that what you named it? Okay.
Everyday living, because you need to find out how they live every day. And so if they do need help, they would hold the bath cloth for me.
Yes.
Or hold the soap for me.
Right.
Couldn't get to their back, then I would help them.
Maybe lather up.
But they're still telling me how they want it done.
That's wonderful.
So I think knowing that they have they're empowered to do that, because I learned very quickly when I went to be a director of nursing of a small hospital, 62 bed, that the people I had to depend on the most were the aides.
They're boots on the ground, right?
I learned so much from them, and then they taught me so much about ADLs.
Yes.
That I did not know.
Right.
As an RN, we get caught up in
the medical
what we think
side
we
of
know.
things.
Rather than the personal side of things. So the other thing is getting the staff to understand what chronic conditions the person has that could limit their ability to
so maybe
care
arthritis with
could
reach
be, sight.
Right. That's a good one too.
Hearing. So they are only maybe capturing part of what you're saying.
Right.
So the demonstration, I'm going to take the soap, I'm going to lather your back. It's very important that you gesture. As you talk. Because they will follow you. Right.
That's the universal language, right?
It is, yes. And so, and learning from, if that person, they're already there, you're going to learn from the CNAs that helped them before.
Yes.
How to help them with bath.
Yeah. I find it interesting that some professional caregivers would go in to a particular client and everything would be hunky-dory fine. And then there would be someone else that, again, knows the tasks that need to be done, but for some reason, they're not. There's a friction or agitation. And I think that a lot of it probably has to do with what you're talking about. It's not just personality. That's not the issue.
No, I think you have to, when I do my dementia care classes, to get control, you lose control. You let the other person control.
Yes.
And they have to really accept that
Yes.
and not be threatened by it.
Right.
Because it's so much easier to tell them to do this, do
Right.
this, do this.
I don't know if you know this, but I'm a certified fearless living coach. And one of the things that they, tell us is in training is about toxic coaching. And that is when you're leading someone to something. And the phrase that they use that when you were talking about that came to mind to me was lead by following.
Yes.
That's really important. And you have to, a person who's confident in their knowledge and what they're doing is capable of doing that. Someone who's maybe a little insecure might feel vulnerable by doing that. So I think your training would give them that confidence.
And I also was able to, in doing some preparation for today.
Yes.
That was my Sunday, was preparing for, no, I didn't take the whole day.
Now you're making me feel guilty.
No, well, good. Now I missed one of my shows. No. Anyway, is that I just did not recognize that doing things for someone when they don't need it done, this learned dependency, is because it's hopeless. That what are they going to do?
I want to write this down. Doing things for someone when they don't need, right?
Yeah, well, they don't need the help.
Right.
It's often the number one diagnosis that I found was with people that are depressed.
Yes, very true.
They're just going to let you do it. They're not going to make the effort.
Right.
And
to make their wants known.
If they've been conditioned to be helped all the way through for a long time, they're not going to resist you, even though emotionally.
Yes. It's damaging to them.
Yes, it's very damaging. And in one article that I read, it was considered trauma.
I believe
to the person.
Especially if they're in a vulnerable state. I could see that being the case.
And so then another with the staff is, of course, their body language in doing it. If they are, let's say they're someone has a rash,
right?
We just discovered it, and it let's say it was a yeast rash that had quite an odor. You must be very aware of what your facial expression is.
Yeah.
And tell them what you see.
Yeah.
This is what I see back here. You've got a rash on your back. We'll make sure the nurse knows.
Right.
And so they know you're attentive to their body.
Yes.
And if you've been with them, then the change that you see.
Yes.
Then that is
important.
it is.
It's very important.
It's very important. And so then also the tone of their voice.
Yes.
Now, I'm going to ask you a question. Do you know the voice tone that universally is the most favored person that speaks?
English accent.
No, but it is a celebrity has the most appealing voice.
I can't think of his name. Tell me.
Morgan Freeman.
That's what I was thinking.
It is.
I swear.
It's him.
I was thinking he does a lot of the God Bible verses and anyway. So
Yes, he's the most appealing voice.
Interesting.
I know. If he told me to go jump off of a bridge, I'd probably say, which one?
We're getting close to our time.
Okay.
But I said English because I used to be an HR director in a hospital, and I had an English, a gal had an English accent, and I would do corrective actions with people. And it was, it's not an easy thing to do.
No.
But she would go in, and they would come out hugging, smiling, just because she had an English accent. Anyway. So, what else in the few minutes that we have left would be something that you would want to share that you didn't get a chance yet to?
Let me see. I've got to say something profound.
Okay. Oh, you already did. When you said doing things for someone when they don't need the help is learned dependency. I mean,
I think that the big step for us is to work with families and not promoting this learned dependency. So I don't want to take a long time, but also in doing the assessments, I found people who were at home with caregivers.
Yes.
And the caregivers had done everything for them.
Yes.
And so I was faced with a balance of, do they qualify for assisted living? Because they don't do this anymore.
That is do you see the light bulb going on top of my head?
Yes. For me. And so I was able to bring 2 in with a very specific care plan.
Like a deprogramming.
Yes, that worked. But it took a lot of effort on the staff and on trying to understand the resident and working with the family. And we were successful with 2. But I did not imagine I would find.
So I'm writing down, will you disqualify someone for assisted living by doing too much for them?
Yes.
Wow.
And that can happen.
Annette, words of wisdom and all your work to put this together is really going to help people. Thank you so much.
I enjoyed it.